Have you ever seen the movie Rain Man? In the movie, Dustin Hoffman plays Raymond, an autistic savant who has superb recall with little understanding of the subject matter and extreme mathematical skills. He is frightened by change and adheres to strict routines. Except when he is in distress, he shows little emotional expression and avoids eye contact. I have a son, Nicholas, who is autistic. He too, like Raymond, shares all the same aspects, except that he is higher functional. He's extremely smart and has an IQ of a 19-year-old. Have I mentioned that he is only 11? He is more verbal and knows a lot about a variety of subjects. I have learned a lot about autism since my son was diagnosed 5 years ago. Children with autism generally have problems in 3 crucial areas of development: social interaction, language, and behavior. The prevalence of autism is about 1 to 2 per 1,000 people worldwide. However, the Centers for Disease Control and Prevention reports approximately 9 per 1,000 children in the United States are diagnosed with autism spectrum disorders. The number of children diagnosed with autism appears to be rising. It's not clear whether this is due to better detection and reporting of autism, a real increase in the number of cases, or both. While there is no cure for autism, intensive early treatment can make a big difference in the lives of many children with the disorder. Good evening. My name is Stephanie Lauren, and I'm going to inform you about what autism is, its causes, how you can treat it, and if there is a cure. What is autism? Autism is a disorder of neural development characterized by impaired social interaction and communication, and by restricted and repetitive behavior. These signs all begin before a child is 3 years old. Children with autism generally have problems in 3 crucial areas of development: social interaction, language, and behavior. But because autism symptoms vary greatly, 2 children with the same diagnosis may act quite differently and have strikingly different skills. In most cases, though, severe autism is marked by a complete inability to communicate or interact with other people. Some children show signs of autism in early infancy. Other children may develop normally for the first few months or years of life, but then suddenly become withdrawn, become aggressive, or lose language skills they've already acquired. Autism affects information processing in the brain by altering how nerve cells and their synapses connect and organize. How this occurs is not well understood. Autism is one of 3 recognized disorders in the autism spectrum, the other 2 being Asperger's syndrome, which lacks delays in cognitive development and language, and pervasive developmental disorder not otherwise specified, commonly abbreviated as PDD-NOS, which my son is diagnosed as, which is diagnosed when the full set of criteria for autism or Asperger's syndrome are not met. What causes autism? It has been long presumed that there is a common cause at the genetic, cognitive, and neural levels for autism's characteristic triad of symptoms. However, there is increasing suspicion that autism is instead a complex disorder whose core aspects have distinct causes that often co-occur. Autism has a strong genetic basis. Although the genetics of autism are complex, it is unclear whether autistic spectrum disorders is explained more by rare mutations with major effects or by rare multi-gene interactions of common genetic variants. Complexity arises due to interactions among multiple genes, the environment, and epigenetic factors which do not change DNA but are heritable and influence gene expression. Several lines of evidence point to synaptic dysfunction as a cause of autism. Some rare mutations may lead to autism by disrupting some synaptic pathways, such as those involved with cell adhesion. Gene replacement studies in mice suggests that autistic symptoms are closely related to later developmental steps that depend on activity in synapses and on activity-dependent changes. Although evidence for other environmental causes is anecdotal and has not been confirmed by reliable studies. Environmental factors that have been claimed to contribute to or exacerbate autism or may be important in future research include certain foods, infectious disease, alcohol, smoking, illicit drugs, vaccines, and prenatal stress. Although no links have been found, some have been completely disproven. Parents may first become aware of autistic symptoms in their child around the time of a routine vaccination. This has led to unsupported theories blaming vaccine overload, a vaccine preservation, or the MMR vaccine for causing autism. How do you treat autism? The main goals when treating children with autism are to lessen associated deficits and family distress, and to increase quality of life and functional independence. No single treatment is best, and treatment is typically tailored to the child's needs. Families and the educational system are the main resources for treatment. Educational interventions can be effective to varying degrees in most children. Intensive, sustained special education programs and behavior therapy early in life can help children acquire self-care, social, and job skills, and offer improved functioning and decreased symptom severity and maladaptive behaviors. The appropriateness of including children with varying severity of autism spectrum disorders in the general education population is a subject of current debate among educators and researchers. Many medications are used to treat autism spectrum disorders, symptoms that interfere with integrating a child into home or school when behavioral treatment fails. More than half of U.S. children diagnosed with autistic spectrum disorders are prescribed psychoactive drugs or anticonvulsants, with the most common drug classes being antidepressants, stimulants, and antipsychotics. A person with autistic spectrum disorders may respond atypically to medications. The medications can have adverse effects, and no known medication relieves autism's core symptoms of social and communication impairments. Is there a cure for autism? There is no known cure. Children recover occasionally so that they lose their diagnosis of autistic spectrum disorder. This occurs sometimes after intensive treatment and sometimes not. It is not known how often recovery happens. Reported rates in unselected samples of children with autistic spectrum disorders have ranged from 3% to 25%. Most autistic children can acquire language by age 5 or younger. Though a few have developed communication skills in later years, most children with autism lack social support, meaningful relationships, future employment opportunities, or self-determination. Although core difficulties tend to persist, symptoms often become less severe with age. Few high-quality studies address long-term prognosis. Some adults show modest improvement in communication skills, but a few decline. No study has focused on autism after midlife. Acquiring language before age 6, having an IQ above 50, and having a marketable skill all predict better outcomes. Independent living is unlikely with severe autism. So to conclude, despite all the day-to-day hurdles, many people with autism lead fulfilling, happy lives on their own or with help from friends and family. They have individual tastes and enjoy different activities just like we all do. There are many websites to learn more about autism. For more information, visit the Autism Speaks Interactive Autism Networking website at www.autismspeaks.org. You may also want to visit the website for the National Institute for Neurological Disorders and Stroke at www.ninds.nih.gov. Thank you and have a good evening.